Hello, my name is Caitlin Boyles. I am an Indiana State University student in the LPN to BSN nursing program. This is Clinical Video 3 for Community Health Nursing 444, Healthy Lifestyle. This presentation is geared towards the average American adult that may be interested in learning or thinking about changing health habits. At the conclusion of this presentation, participants will be able to identify the 9 modifiable risk factors that account for 90% of heart disease cases, describe the most effective way for individuals to quit smoking, plan a healthy diet with recommended amounts of macronutrients, determine if an exercise routine meets recommended standards, and list ways to improve mental health. What is a healthy lifestyle? There is no one way to be healthy. Healthy lifestyles include doing things that make you happy and doing things that make you feel good. A healthy lifestyle is a way of living that lowers the risk of being seriously ill or dying prematurely. Why you should want a healthy lifestyle. Approximately 90% of heart disease can be prevented by a healthy lifestyle. 90%. What factors account for the 90% risk of a heart attack? Smoking, high cholesterol, hypertension, diabetes, obesity, diet, physical activity, alcohol consumption, and psychosocial factors. If you smoke, it's important to reduce or quit smoking. So what can you do to help quit smoking? There are several different methods, which include quitting abruptly, also called cold turkey, reducing smoking before quitting, or reducing the amount that you smoke without a plan to actually quit smoking. All of these will help lower your risk of heart disease. The most effective method is to use a combination of medications and behavioral support. Medications can be nicotine replacement therapies, bupropion, or Chantix. In one study, participants were given standard doses of nicotine replacement therapy, or Chantix, for periods of 2 to 18 months. Participants that used the medication were almost 1.5 times more likely to be free from cigarettes after 6 months. Adding behavioral treatments to medications increases cessation rates. When treatments are combined, long-term abstinence rates approach 25 to 30%. What about cholesterol? What can you do to help lower your cholesterol? The main ways are to eat a healthy diet, exercise on most days of the week, quit smoking, lose weight, drink alcohol in moderation, and if those don't work, consider medications if lifestyle modifications are not enough. What can you do to help lower blood pressure? Lose weight, exercise regularly, eat a healthy diet, reduce sodium or salt in your diet, drink only in moderation, quit smoking, cut back on caffeine intake, reduce stress, and consider medications if lifestyle changes are not enough. Are we noticing a pattern here? What about reducing your risk of diabetes? Lose weight, get more exercise, and eat healthy foods. What can you do to reduce your risk of obesity or reduce your weight? Eat a healthy diet, exercise regularly, get enough sleep, and reduce stress. So everything kind of boils down to healthy diet, lose weight, reduce stress, and exercise. So how do we go about doing that? We need to learn what a healthy diet is to be able to follow a healthy diet. So a healthy diet, 30% of your calories should come from vegetables. And we should really focus on eating the whole vegetables, not just the vegetable juices or like fried pickles, but we need to actually be eating the cucumbers. 20% of your calories should come from fruits. And again, we need to focus on the whole fruits. While 100% fruit juice does count as a serving of fruits, you need to be eating the whole fruit so that you get the fiber from those nutrients as well as the nutrients. 30% of the calories should come from grains, and at least half of the grains should be whole grains. 20% of your calories should come from proteins, and you should choose lean and low-fat proteins. And then you should have sides of dairy. You can find more information on this at myplate.gov. They will also there help you make meal plans and they have a way to make affordable meal planning. Physical activity. Adults need both aerobic activity and strength training. We should aim for 30 minutes of aerobic activity a day, 5 days a week. There are different ways to get the aerobic activity, from a hardcore gym session to planning a 30-minute walk every day. For strength training, we need to aim for 8 to 12 repetitions per activity, which counts as 1 set. Strength training should be done 2 days a week. And we should aim for at least 1 set of muscle strengthening activities those 2 days, trying to target all of the major muscle groups. This can be done by lifting weights, using resistance bands, body weight resistance such as push-ups or sit-ups. Alcohol consumption. We should limit our alcohol consumption to 2 drinks a day for men or less, and 1 drink a day or less for women. If drinking is a problem if it causes trouble in your relationships, schooling, social activities, or how you think or feel. If you are concerned that either you or someone in your family might have a drinking problem, consult your personal health care provider or call 1-800-662-HELP. Psychosocial factors that increase the risk of heart disease are low socioeconomic status, lack of social support, stress at work and in family life, anxiety disorders, and depression have all been shown to increase the risk of developing cardiovascular disease. Improve your mental health by taking care of your body, learning how to deal with stress, practice meditation, mindfulness, or relaxation exercises, set realistic goals, and most importantly, get help when you need it. There has been a stigma put around seeking help for mental health issues, and there shouldn't be. There is nothing wrong with seeking help. Here is a link to the post test. If you would please go ahead and take the post test, that would be wonderful. And here is a list of the references that were used for this presentation. Thank you.